Talicia asked, what is the best way to get owner compliance? And one thing that we have to keep in mind, and this is really important in general, with what we're talking about today, dental radiographs that are full mouth radiographs, we're talking about doing advanced surgical extraction procedures, which take a long time. Again, we talked about 2 to 3 hours. That is 20% of your client base. That's not the other 80%. And if you look at that whole dynamic, that's not anything different for just dentistry. That's the same thing with any high-end service that you offer in your practice. Cardiology workup, full workup for a heartworm treatment, referral for a fractured limb. The clients that are the clients that can afford and have the attachment emotionally to the patient that will do those procedures are 20% of your client base. The other 80% are not going to consider that. So that's the first thing that you need to keep in mind. When you go in that exam room, 20% of your clients are going to say yes. The other 20% are not for that type of service. So those are the clients that are also responsible. That 20% is responsible for 80% of the practice revenue in that practice. So, and they're also the ones that are the nicest. They're the ones that don't cause problems, as opposed to the other 80%, which are going to complain most of the time, no matter what you do. So those are the clients that are going to take this high-end service. So your compliance efforts are probably pretty good. It's just that you have to keep in mind that only 20% of the people you talk to are going to say yes for that. And that being said, when you registered for this course, you got that image library. And in that image library are those 4 slides that talk about compliance. And there should be a video available to you as well that show you how to walk through that with the client itself. So all that's there for you.